is your food a slow poison, or is it actually a medicine? I would actually argue, and the training I'm having or constantly having, or the doctors I'm listening to that I respect, they describe food as being the most powerful medicine known to humankind. And I would totally agree with you. It never ceases to amaze me, even though I sort of understand some of the science that goes on behind this. It never ceases to amaze me what happens when you get the diet right, or the environment right, and the diet right, with a client that's presenting with conditions that basically they have had no resolution, they've had no ability to actually solve until they actually change what they eat and their environment. The body requires, I mean, we're a collection of 36 trillion cells, as I've said to you. And the body requires, each cell, if you look at it on a cellular basis, requires 250 different micronutrients to function properly. Well, where are we going to get those micronutrients from? Food. So you've got to eat it. You've got to eat it, and you've got to digest it well, and you've got to absorb it well. And so your gut has got to be in shape if the cells are going to have those micronutrients. What happens if those cells do not get those micronutrients? You end up with cells that are not happy. And the cells that are not happy are cells that basically cause disease, disease. Food provides signals to your DNA. It is quite incredible, the concept of nutrigenomics. We call it nutrigenomics. And it is fascinating. You can actually switch on and switch off genes by using certain foods. And it is powerful. In fact, there's a really interesting study that Dr. Michael Mosley, you probably know Dr. Michael Mosley, he does Trust Me, I'm a Doctor, and he's a great doctor. And he was talking about this study that they run in Gambia, and they collected since the 1940s onwards, they actually collected data on a particular group of people and their health and well-being. And what was incredible was that the health of the children and what happened to the children was completely dependent on when that child was conceived. Was that child conceived in the dry season or conceived in the wet season? And the difference was staggering. So up to the age of 15, there were no differences in their health and well-being. But from that point onwards, they literally parted company. And for those who were conceived in the dry season, they were 7 times more likely to die of an issue, a disease, than their counterparts who were conceived in the rainy season. That is an incredible difference. I mean, we're not talking a few percentage points. We're talking hundreds and hundreds and hundreds of percentage difference here. So why? What is causing that huge discrepancy in outcome? And what it comes down to is the wet season or the dry season. And in the wet season, the parents are eating typically lots of fruits and vegetables, dark green leafy vegetables. They're getting lots of folate, lots of things, all the things that are in these wonderful vegetables are being consumed on a regular basis. In the dry season, it's completely different. And there's something called methylation, which actually expresses genes or doesn't. And methylation is dependent upon a lot of the components that are eaten in these dark green leafy vegetables. So this food consumption was literally switching genes on and off that were going to benefit offspring at the point of conception. That is incredible in terms of the difference. But also, what's even more amazing is that it didn't just affect the generation that's coming, it affects the following generation as well. I think that's incredible. So, food sensitivity testing. Now, this is a big area, and in fact, it's one of the most common sought-after tests. And I think you probably know by now what I'm going to say about this, but food-sensitive testing can be brilliant in certain situations, and it really does depend on the test. The test is only as good as the test. If you're not measuring something, you obviously can't make an opinion on it. So, for example, a lot of food sensitivity tests are done using IgG, which is part of the adaptive immune system we talked earlier on, so the immunoglobulin G. And if you're just measuring immunoglobulin G response, well, you may hit a response, you may not hit a response, because what happens if it's the immunoglobulin A that's responding? You know, the G might not be responding, but it might be the A. So if you're not measuring A, you can't obviously tell that. So if a response comes back and says, well, there's not a problem with potato on IgG, how do you know there's not a problem with potato on IgA? So you need to understand that we've got to look at different arms of the immune system. So which parts is really, really key. Then you start looking at things like, well, is the lab testing for organic foods or non-organic foods? Because we know that if they're non-organic, the chances are that they're probably got some sort of external agent in there, and there's probably some sort of what we call neoantigen complex that's been created. So are you responding to the neoantigen complex or the organic complex? It depends on what you're eating. So the result can be skewed that way. Cooked versus raw, this is really big. I mean, cooked food is more antigenic, more immune system stimulating than raw food. So if you're having a test done, for example, on your reaction to chicken, we know that cooked chicken is massively more immune response, provokes the immune system far more than raw chicken. But how many people in here eat raw chicken? Or raw eggs? Probably more likely to eat raw eggs if you did do that. But anyway, cooked eggs are far more antigenic, immune-provoking than raw eggs. So is the lab using raw or cooked? Because they need to be using the material that you're likely to be, how you're likely to be consuming it, for obvious reasons. What about the concentration of the antigen on the plate? You know, there's only 0.2% of protein in an apple, but actually there's a lot more protein in an almond. So if you put enough protein into something, you will get a response eventually. Plate contamination. Not everyone's immune systems are built identically. We have genetic propensities to do things better or worse. That's the uniqueness of us. So this is a test. In fact, this is an example of a report from the test that we're giving away two of tonight to two people in this room. And this is a test done by a lab called Dunwoody in the USA, and it is a phenomenal test. It's testing, it's a best-of-breed test. Now, there's no lab as yet that does, not that I've come across anyway, that does tests for every single part of the immune system for every single food. I mean, that would be impossible. Here, we're testing for 88 reactions to food proteins across different food groups. And I use this a lot in clinic, and it can be incredibly useful. But the beauty of this test, and the reason I choose it, is because it's looking at different arms of the immune system. So this is giving you a response to IgG, which we talked about, but total IgG, because there's 4 subtypes of IgG, 1, 2, 3, 4. And it's also giving you what we call the complement response. And that's when I talked about complement earlier on, that was the innate immune response, the first response. So let's drill down into this. So in this particular example, the client here is actually reacting. 5 is red, as you can imagine, is the severe reaction. Okay? So they're actually reacting to fruits in this particular instance. So green pepper, honeydew melon, lime, lemon, okay, are significant reactions. That's top of the scale. This is for mid-range, and that's way down the bottom. Okay? Now, forget the numbers, because that's represented by the color here. Okay? So red color, bad. Blue is no reaction at all. What's here on the right column is yes, means yes, there's complement. And if complement is present, as well as having a high IgG, adaptive response, you've got a problem with that particular food. But you see, normally, if you're not measuring this, what you would do is you'd say, all right, Mr. Client, or Mrs. Client, we need to take out all these foods from your diet. Now, depending on the clinical context, you've always got to look at the client. You've always got to say, well, how are they presenting? What are their symptoms? How bad are they? Because what you don't want to do is make life really difficult for people. And you may, by just taking out the things that are really problematic, just taking out, for example, green peppers and leaving the rest in, could have a significant impact on reducing inflammation. So you don't just take out everything. What happens if you just test for IgGs? You just take everything out that's got a 5. So that could become incredibly restrictive. Is that reasonably clear? Okay. So, let's move on to a subject that I love, gluten-related disorders. And here we're talking about three main things: wheat allergy, non-celiac gluten sensitivity, and celiac disease. Now, gluten-related disorder is the umbrella term for those three conditions, okay? And wheat allergy, we're not talking about tonight because it's an allergy. It's pretty obvious if you have an allergy to wheat. So we park that for tonight. What I'm interested in talking to you this evening about is non-celiac gluten sensitivity and celiac disease, which are absolutely connected to inappropriate immunological responses or sensitivities to gluten. Gluten, which is the structural protein found in grains, but we're talking specifically about barley, rye, and wheat here. There has been a significant increase in the past few decades of gluten-related disorders. And you have to, again, ask yourself the question, well, what is going on? Why is that happening? And actually, when you drill down into celiac disease, which we'll talk about more in a minute, in the last 50 years, there's very strong research to validate the fact that it's actually increased fourfold in the past 50 years. Now, that is not entirely down to us diagnosing it better, by the way. So you have to ask yourself the question, why? And actually, when you start lifting the lid on this and actually asking the question why, you begin to get multiple sort of reasons as to what might be going on here. So for example, wheat has been hybridized and hybridized and hybridized, and it's been hybridized for obvious reasons, to increase yield, because obviously we've got more mouths on the planet and we need to feed them. So dwarf wheat is the biggest part of wheat production. Wheat is the most heavily consumed grain on the planet. So hybridizing wheat makes sense because you get more yield. However, when you look at it from a chromosome perspective, and just to put it in perspective, the difference between my wife and myself, being man and a woman, is one chromosome. So the difference between einkorn wheat, which is ancient wheat, and modern-day dwarf wheat is 28 chromosomes. And that's happened in a period of 40, 50 years. We've hybridized it. So chromosomes equates proteins. Proteins equates to potential sensitivities because the body's seeing these things, and do you know what? It doesn't know what. It looks at these things and it goes, well, what is that? I've never seen it before. Or I can't break it down. I haven't got the toolkit to break it down. And if you're not breaking these things down, you can end up with a cascade where inflammation just get out of control in the gut, in particular. So hybridization is one thing. So is the use of pesticides. Crop desiccation is used in the Northern Hemisphere because we tend to have dampish summers, and of course that's when harvest is done. So what is done and promoted is say, well, let's spray our crops with glyphosate, Roundup, just before harvest. But of course it's safe. Of course it's safe. It's safe according to Codex Alimentarius, but is it safe? And what they don't tell you is that actually Roundup really does impact the balance of your microflora. Excuse me a second. Talking too much. Oops. So, yeah, if you're taking Roundup on your breakfast cereal, that is a problem, or you're taking it on the slices of toast that you have in the morning, the authorities that are say, well, okay, this is not a problem, but is it really not a problem? And we know through the science that glyphosate can, as I said, actually impact how your bacterial balance in your gut works. And that, of course, can lead to systemic problems. So pesticides, herbicides, fungicides on food is potentially an issue, and especially on grains, by the way. So let's talk about non-celiac gluten sensitivity. Now, this is exactly what it says. This is not celiac, and it's a gluten sensitivity. Celiac is an autoimmune response, and non-celiac gluten sensitivity is just an immune response. It doesn't mean the body is starting to attack the immune system is starting to attack various parts of the body, which we'll talk about in a minute with celiac disease. There is no official test for non-celiac gluten sensitivity. So you can't be diagnosed. You can't have a test and say, well, this is categorically non-celiac gluten sensitivity. It is diagnosed by exclusion. So what happens is you're tested for celiac disease, and it's negative, and you're tested for wheat allergy, and there's no allergy or no allergic response. So what then happens is if it appears that by taking gluten out of the diet, you actually feel better, then you might be classified as a non-celiac gluten sensitive. Although, again, modern medicine is not particularly happy to do that on a regular basis, because there's a lot of controversy about this particular area, because it isn't something you can officially diagnose as a condition. But it definitely is a condition. And it's more frequent in adults. The typical age of diagnosis of non-celiac gluten sensitivity is about 40, and it's more common in women. And the typical sort of symptoms, and the biggest one is IBS. IBS is really, really prevalent in this particular condition. And you will know, because if you exclude gluten from your diet, you get rapid results. You start to feel a lot better very quickly, within days. You start to get less abdominal cramping, more stable output, and things just generally feel better. Abdominal pain, foggy head, headaches, fatigue, joint muscle pain, numbness, eczema, these are all classic symptoms of non-celiac gluten sensitivity. So this, again, is the immune system inappropriately responding to the peptides in gluten and causing these problems. 15 to 25% of adults have IBS, by the way. That's a lot. It's a big, big section of society is struggling with this condition, and sometimes told that it's just normal. Well, it's not normal. It might be normal, but it's certainly not optimal. So celiac disease. Now, this is the autoimmune part of the gluten-related disorders. So this is where autoimmunity, let's talk about autoimmunity briefly. What is autoimmunity? Autoimmunity is loss of self-tolerance. The immune system starts to attack your body. So the sort of things we're talking about here are Hashimoto's, where the immune system starts to attack the thyroid. Rheumatoid arthritis, where the immune system starts to attack the joints. Type 1 diabetes, where the immune system starts to attack the pancreas, so you can't produce insulin. And of course, celiac disease, where the immune system starts to attack the small intestine, the villi in the small intestine, the little finger-like protrusions that we talked about. So celiac disease is, I would argue, massively misunderstood. And we know through research that it's one of the most common lifelong disorders in both Europe and the United States. Now, that is a quote from the New England Journal of Medicine, okay, which is a reputable, peer-reviewed journal, medical journal, some time ago, 2003. And that, to me, is an amazing statement. One of the most common lifelong disorders. We then go on to say that the size of the iceberg, so what is undetected, as you know, icebergs have a lot more under the water than above the water, so this celiac iceberg, in the UK is estimated to be 1 in 8. So that means only 1 in 8 celiacs are probably ever diagnosed. Again, that is a mind-boggling statistic, from Gut, another reputable medical journal, by the way, 2006. So how many people are walking around with undiagnosed celiac disease? You don't have to present with abdominal cramping and diarrhea to have celiac disease. Less than 40% of celiacs present with abdominal cramping and diarrhea. It can be silent celiac disease. You can have perfect output, perfect digestion, yet you may be presenting with neurological degradation. It might be MS-type symptoms, numbness and tingling in extremities. Mouth ulcers is a classic one. There's a campaign being run by Celiac UK where they're talking about mouth ulcers. Mouth ulcers are prevalent with people who are presenting with celiac disease. Psoriasis, fatigue, migraines, osteoporosis. These are all classic symptoms of celiac disease. And it is really insidious. It's really insidious celiac disease because the immune system, which has been triggered by a sensitivity to the proteins in gluten, is inappropriately responding and causing a cascade where you lose oral tolerance, so you cause an inflammatory cascade. And those that have a genetic predisposition, and there is a genetic base to this as well, causes the immune system to attack the small intestine. So you're attacking the small intestine and you're damaging the finger-like protrusions called villi, in the small intestine. And if you damage the finger-like protrusions in the small intestine, you reduce the surface area from a tennis court down to maybe a snooker table, for argument's sake. So what's that going to do to your absorption, to the ability of you to absorb nutrients from your food? You could be eating the best, well, potentially a great diet, but you're still eating gluten, and you could be taking digestive enzymes, you could be taking supplements, you could be taking all the things, and actually you still are not absorbing your nutrients properly because you're actually perpetuating that autoimmune cascade. So you won't absorb your nutrients properly, so your cells won't function, which means you're going to develop disease, chronic disease. So I would go so far as to say, well, did they die of cardiovascular disease? Did they die of dementia? Or was it actually undiagnosed celiac disease? If there's any chronic condition that you know you are presenting with, or friends or loved ones are presenting with, and nobody can get to the bottom of it, you really need to ask the question, is this a gluten-related disorder? Because it's actually very serious if you don't diagnose it. If it's undiagnosed, it becomes a problem. And of course, the way to deal with it is total elimination. You've got to completely eliminate gluten from the diet. You can't be half pregnant. You've just got to eliminate it. So that means, less than 1/8 of 1 gram is a problem. And there are certain celiacs, okay, that are what we call refractory celiacs. They're up to 5% of celiacs are refractory, which means that they cannot tolerate even the smallest amount of gluten. Okay, so gluten-free foods, for example, you'll be surprised to hear, if you don't know already, are not gluten-free. They're just low in gluten. So Codex Alimentarius, that looks after what the definitions are, states that it's less than 20 parts per million, which is low, I admit that, and most celiacs don't have an issue with that. But if you're a refractory celiac, and that's up to 5% of celiacs, by the way, then you're eating gluten-free bread, you may well, if your symptoms are not getting better and you're not feeling well, you may well be reacting to the gluten that you're eating and consuming through the gluten-free products. It's very confusing, but trust me, it happens. So with IBS, for example, the figures are 7 to 12% of people with IBS have celiac disease, but might be undiagnosed. Neurological degradation, up to 10% of people may have celiac disease. So it may not be MS. I've seen this in my clinic myself, where somebody was diagnosed with MS, but actually it wasn't MS, it was actually silent celiac disease. Fertility issues, up to 8% of mothers and fathers-to-be who have fertility issues may well be caused by undiagnosed celiac disease. So it's a big subject, a really big subject. And let's just drill down into what I talked about in terms of villus atrophy, because what I'm talking about here is this is a small intestine. You've got these little folds in the intestine, and you've got these finger-like protrusions here, the villi that stick out of the side, and this is where you absorb your nutrients. So healthy villi, damaged or flattened villi, and of course that reduces dramatically the surface area of your small intestine to the point where you just don't absorb your nutrients properly. So what's a classic sign of celiac disease? Iron deficiency anemia. It's classic. People are taking iron supplementation because their iron levels are low, and they may well be eating heme iron in meat, but they're not absorbing the iron properly. So why do you have to resort to taking iron? Well, because your iron levels are low, I appreciate that. But why are your iron levels low? It's getting to the bottom of why something happens. It's not normal to have to take iron. You should be getting iron from your diet. And the genetic component, just to talk about that for a second, there's a genetic component here, something called HLA-DQ2 and DQ8, which can be tested for. Now, this is not a deterministic test, but what it does is if you test for it, it's a saliva test. It's great to do with children, for example, to see if they're actually potentially have a gluten-related disorder, is to say, well, you have a much greater chance of developing a gluten-related disorder if you have either one of those two polymorphisms, or haplotypes, to be correct. So with villus atrophy, again, it's interesting that full-blown celiac disease is when you have complete villus atrophy. So literally on the right-hand side up there, you can see, there's virtually no protrusions. But you don't just wake up one morning, by the way, with complete villus atrophy. It does happen gradually over time. And the testing in the NHS that they do, the blood test, if you are full-blown celiac, is very, very sensitive and very, very specific, and will pick up 99 times out of 100 somebody who's presenting with celiac disease. However, if you are presenting with partial here, so semi-degraded villi, which a lot of people are, because there's inflammation and things going on and you're reacting to gluten, then the test will come back 7 times out of 10 negative, false negative. And that is not safe, as far as I'm concerned, because when somebody turns around to you and says, well, it's fine, the test result's negative and you can carry on eating gluten, when actually you are actually destroying a villi, the end result is you will end up with no villi, and that is a problem. So what can you do? Well, there's a brilliant lab in America called Cyrex, and we use this, and lots of practitioners like myself use this particular testing to identify problems. And I talked about the NHS test, and it's brilliant if you are a full-blown celiac, but lots of people are on the way to becoming a celiac. And the key thing is to try and identify these things earlier. So what's happening here is you've got various breakdown parts of gluten on the left, excluding this bit at the bottom, and the results should be everything for the client should be in the green zone. And as you can see from these test results, they're not. So anything that's in the yellow or the pink is out of range, and that is an immune response to a particular peptide of gluten or wheat. So anything that's here or there is causing inflammation. And what does inflammation cause? Absolutely. Chronic disease. So if every time you are consuming gluten and your immune system is over-responding every time you eat it or put it on your skin, because it's in lots of things we don't eat, by the way, just to make life even more complex, you are actually provoking an immune response which is going to cause potentially chronic inflammation. Chronic inflammation is the root cause of all chronic disease. So down here on the bottom left-hand side is something called transglutaminase, and this is actually an enzyme. It's like the scaffolding of the gut. Transglutaminase 2 is in the gut, so it holds the villi up. 3 is in the skin, 6 is in the brain. So this particular individual has actually got an immune response to something in the brain, the structure of the brain going on here. So you can use these things to actually identify where the problems are. Okay, so celiac disease. You're diagnosed as a celiac. Is it simply good enough to cut gluten out of your diet? Do you think that's good enough? Well, I can tell you it's not. Yeah, the logical thing to do is to cut gluten, barley, rye, and wheat out of the diet, which is what you're told to do. And sometimes that works, by the way. It works. But often it doesn't. And when you look at the numbers, it's really quite scary. 10 to 15% of celiacs continue to experience health problems after cutting out gluten. only 8% of celiacs completely heal the villi in their gut. 8%. That is a ridiculously low number. And poor vitamin status exists in most celiacs 10 years after taking gluten out of the diet, which is, again, I think, a staggering statistic. Why? You have to ask yourself the question, why? Well, okay, we know that a gluten-free diet is very difficult to do in this modern world. We dine at the table of wheat at breakfast, lunch, dinner, snacks. It's in shampoos. It's in toothpaste. It's in everything. So honestly, it's just everywhere. You start looking at it. So it's very difficult to actually lead a gluten-free life in the modern world, eating the modern way. So contamination is a problem, for sure. And a lot of celiacs will get contaminated. And if they get contaminated, the immune system responds. Again, the logs get thrown on the inflammatory fire, and the fire rages again. And the inflammation builds up. And inflammation causes chronic conditions. So that's why, yes, most people who go gluten-free start to feel better. Of course they do. They get some benefits. But they don't feel optimally well. And I get a lot of celiacs, officially diagnosed celiacs coming to see me because they don't feel well. And they want to know why they don't feel well. So it may be, and you can test, I mean, you can do the Cyrex test and you can actually measure if there's inappropriate immunological responses going on. But the only other problem with this, of course, is that sometimes the immune system is so tired that it won't respond on that particular arm. So we're measuring with Cyrex IgA and IgG. Well, A, you might not be responding there, and B, the immune system might be so tired that it won't actually mount a response. So sometimes you get everything in the green column, but actually you know not everything's right, so you have to dig deeper. But normally you can use a test like that. There are other tests that are coming out as well that you can use, urine tests as well. So contamination is one thing, but what is the other one? What's the other big one? What's the elephant in the room? And what I see often is cross-reactive foods. So these are foods that cause the same immune response that gluten does, okay, and perpetuates the destruction, the autoimmune process in celiacs. So what are those cross-reactive foods? Dairy is a big one. 50% of celiacs cross-react with dairy. Corn, rice, millet, oats. If you go onto Celiac UK website and just type in oats, you'll be amazed at the sort of conversations they've been having about oats. Some people it's fine, other people it's disastrous. But these cross-reactive foods we know cause or perpetuate an immunological cascade. So if you're eating those, you're jumping from the frying pan into the fire. What are these foods? These foods are the foods that you are told you should eat. You should migrate towards. You should consume dairy. You should consume millet. It's gluten-free. Use corn, rice, because they're gluten-free. They're not actually gluten-free. Gluten's in every single grain. But what they're trying to say is that these are not the ones that you will respond to if you have celiac disease. But that isn't actually true because they're cross-reactive. And some people, it's cross-reactions that perpetuate the immunological cascade. So no wonder you're not getting better because you're chucking logs on the immunological fire still. And it's a major problem if you are refractory celiac, by the way, because the end result of having refractory celiac disease is you end up potentially with malignant lymphomas. And this is, really serious, life-threatening. So how do you know if you're cross-reacting? Well, wonderful Cyrex come to the rescue again, and they do this test. And as you can see, we actually have a cross-reactive foods section here, which is basically all the different peptides of, or breakdown proteins of milk, yeast, oats, millet, rice, corn. And then these are the sort of gluten-free grains that people tend to consume. So if you suspect something's going on with a celiac who's eating these sort of gluten-free foods, which are all gluten-free, then you would run this test, and in this particular instance, you can see lots of inflammation is happening. So what you do is you take those foods out of the diet, because if you take those foods out of the diet, the immune system is not inappropriately responding, and therefore you calm the inflammation down. Inflammation is the root cause of chronic disease. So you potentially change what's happening from the point of view of chronic condition. Very powerful test. So this leads us on to autoimmunity, because celiac disease is autoimmune. So as I said, loss of self-tolerance. It's the immune system attacking various parts of the body.